Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Thursday as you are listening to the show today. It is the third Thursday of the month. That means it is Valley Health's Community Health Day, and I am pretty excited. I've got some newbies on the screen with me today. Joining us is Dr. Terral Goode. He is a surgeon and medical director at the Trauma and Acute Care Surgery Center at Winchester Medical Center. Autumn Davis is joining him as well. She is the trauma program manager, and Jennifer Rohrbaugh is here as well. She is with Valley Health Surgical Partners. Thank you guys for meeting up with me this morning to talk a little bit about trauma. I do appreciate your time.
Well, thank you for having us. We appreciate this opportunity.
So let's talk for a second about the trauma center itself, because Dr. Goode, it's kind of a big deal that we have one of these in Winchester, and not even just a trauma center, but a level 2 trauma center.
Yes, I agree. And it is an incredibly important resource for our community. As one of the surgeons that takes care of people with traumatic injury, and also part of a team that includes nurse practitioners, physician's assistants, and other very important members, us being able to care for our neighbors and our families and our friends, I think it brings an incredible amount of satisfaction, and it also helps to reinforce our commitment to the excellent care that we're always striving to provide. As you mentioned, we are a level 2 trauma center, and that means that for all intents and purposes, people that come here to our hospital, we take care of because we have the resources to do so. So, for example, in order to be a level 2 trauma center, you have to have access to vascular surgeons, orthopedic surgeons, neurosurgery is just a few examples. You have to also have dedicated operating room staff and nurses that are skilled and trained in the care of patients with traumatic injury. You also have to have an ICU or intensive care unit that has the capability to manage people with really severe traumatic injuries. You have to be able to run ventilators and give them IV medications that are designed to help support their bodily functions while they're getting through that trauma. We represent a group, an organization that is dedicated to the continuing ongoing care of those patients as well, in terms of pre-hospital presence, having a robust rehabilitation system. So we have our inpatient or acute care component of things, but also knowing that Valley Health is dedicated to being present for every phase of that patient's care. It's also important for people to realize that if you are injured and you have a significant injury, that you won't need to go to DC or to Richmond or get to Charlottesville for your care. That means that you can stay in your community with your support system intact and feel confident that people that are taking care of you have the resources necessary to do the work.
I think sometimes when we hear about a traumatic injury or something that has happened to a friend or a family member or to ourselves, initially we're just thinking about the incident that caused the trauma and not necessarily what's going to be involved in getting well and getting past it and all of the different resources that you just mentioned.
And I think that's an easy thing to not be aware of. I mean, those are less dramatic, right? The actual trauma is what gets people's attention. As an example, when we have people who come in here with severe injuries, the first thing that if they're in a car crash, the first thing they want to do is show me what the car looks like. Like, man, the whole front end of this car is just smashed in. You have no idea how they survived that crash. It is easy because that's what you can see. What I think a good trauma system does is work in the background. I think that if we do our job correctly, things happen very smoothly. And all of the work that happens in the background is more just the whole process of healing and not necessarily something that you would see. I think even patients and their families, they see us, they see myself, they see Jenny, they see Autumn, and we're the face of the service. But man, there are just an army of folks who are working behind the scenes. The bedside nurses that are attending to their acute needs for pain control and making sure that they're getting their own medications. You have CNAs and mobility techs that are also there and dedicated to making sure that patients are getting up and being mobilized in order to maintain their strength and to kind of capitalize on their ability for rehabilitation. You have the staff for transportation. They're making sure that folks are getting to their tests the way they're supposed to. And you have folks who work in sanitation, making sure that our facility is clean and free of risks for continued infections. I mean, the team is vast. And if they do their job right, it just happens smoothly. And you may not even consider them as part of the collective effort.
Autumn, as the trauma program manager, are you the one that's kind of making sure all of those pieces fall into place and everything works and runs and goes as smoothly as it possibly can?
Yes, ma'am. So I'm really not in the front line. A lot of the patients don't see me as soon as they roll through the door, but it may be a continuum of care. Once they're in bed, we'll come around on the patient. But my job really is to ensure that we take care of the performance improvement and we have all of the things and we allow the nurses to be able to take care of our patients to the very best of our ability. So I'm more of the facilitator to ensure everyone has the things to take the very best care of the patients at all times and really see the throughput through the patients and ensure that they're on the right track. A lot of times the trauma doesn't really end when they leave the building. So one of the new initiatives that we've started this year is the Survivors Network, and really seeing through the patient gets the emotional and mental support that they need when their physical needs are met. So it's really a continuum of care. And like you said, I kind of oversee, ensure that things are kind of rolling on the right track and then pumping the brakes and making sure if there's something that we can do better, we strive to make sure that we can provide excellence in everything that we do at Winchester.
You're kind of like the woman behind the curtain.
Yes, I am the woman behind the curtain.
Smoke and mirrors back there. Truthfully, Autumn, she's probably being a little too humble too. I mean, the work that she does is pretty integral to the success of the program. And it really is about making sure that we are looking at things from a programmatic standpoint. And we have set certain standards for care that she ensures that we meet. We have discussions about ways in which we get better, and there needs to be integrity in that process. She looks at what resources that we have in the hospital and where is the gap analysis? Where do we need more things? She carries that to me and she takes it to administration, to our executive team. She is the liaison for our pre-hospital partners. She also works with the subspecialties here inside our walls, making sure that they are being supported and that we're also make sure that we're working in an environment where honesty and collaboration is prioritized. So it is a collaborative effort. Certainly not any one of us is able to be successful in such a large endeavor. Each one of us has our strengths to bear and making sure that we work together to achieve the same goal and to have the same vision, which I think is the key to success.
And Jenny, where does Valley Health Surgical Partners enter the mix?
So that's kind of the name of the group of surgeons and advanced practice clinicians who take care of the patients, which is probably the most fun part. Autumn and Dr. Goode get to make sure we have what we need, but Dr. Goode gets to take care of a lot of patients too, lucky him. The best part about our job is being able to take care of people, hopefully make them better. They're coming in here, they're not expecting to be here. This is not anything planned or elective or what you thought you were going to be doing that day. So the patients come in, they've had a major event in their life, and we get to take care of them. So I'm one of the nurse practitioners with our team. Like Dr. Goode alluded to, there's a huge team of people who take care of patients in this hospital and throughout our organization. So I'm just one part of that. We do get to see the patients when they come in through the emergency room, kind of the start of their journey. And then we see them through their care here. We help get them admitted to the hospital. If they need to come, we round on them. We set up discharges for them. And then we get to see them back. If they had a significant enough trauma, we get to see them back in our clinic, which is where the name comes from, Valley Health Surgical Partners, but the outpatient part of it, and really see them through their rehabilitation. So that's nice to see them from beginning to end and see them definitely get better is always the goal for us and for the patients.
Well, let's take a quick break. When we come back, Dr. Goode, can we talk about some examples of trauma? Because I'm a huge fan of the medical shows on TV. And there's a phrase, when I realized you were going to be my guest today, there's a phrase that has been stuck in my head, and it is garden variety trauma versus real trauma. And I know they're all trauma, but I want to know what garden variety trauma looks like in real life, not just on the television. Can we do some examples and maybe talk a little prevention in the next segment?
Sure. That sounds great.
We're going to take a quick break. When we come back, we're going to continue our conversation for our Community Health Partnership Day in partnership with Valley Health. Remember, that's where we talk every single month to someone from the Valley Health team. And we have talked to a lot of different providers. We have talked to administrators. I've talked to heart people and liver people and colon people and all kinds of different people. Today, it is trauma's turn at the mic. We're going to come back and continue our conversation with Dr. Goode. He is the medical director at the Trauma and Acute Care Surgery Center at Winchester Medical Center. Autumn Davis and Jennifer Rohrbaugh are going to join us as well. Hang in there. We'll be back in just a couple of minutes.
Got a financial decision to make or a goal to reach, but you don't know where to start? You've come to the right place. Introducing Quick Money Chats with the Northern Shenandoah Valley Financial Education Program. Visit tinyurl.com/quickmoneychat to schedule a virtual chat with a staff member or trained volunteer. We won't tell you what to do, but we will give you the tools you need to choose wisely. And because Virginia Cooperative Extension is part of Virginia Tech and Virginia State, your land-grant universities, you can be sure that our information is credible and trustworthy. And you'll know that we aren't trying to sell you something. Maybe you want to improve your credit score, or reduce your banking overdraft fees, or even figure out if you can afford to buy that car. Sorting through tons of information on the internet can be overwhelming, and sometimes it can be hard to know who to trust. Schedule a Quick Money Chat and get the information you need to take action. Go to tinyurl.com/quickmoneychat and get financial education personalized for you.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Thursday. As you are listening to the show today, we are chatting with Dr. Terral Goode. He is the surgeon and medical director at the Trauma and Acute Care Center at Winchester Medical Center. Joining him on the screen is Autumn Davis. She is the trauma program manager, and Jennifer Rohrbaugh. She is with Valley Health Surgical Partners. We talked in the first segment a little bit about the trauma center at Winchester Medical Center, the fact that it's a level 2, and that's really kind of a big deal. When we went to break, Dr. Goode, I was asking about the types of trauma. And I know you have some statistics for 2020 about the number of people that entered into the trauma registry, 1,672 patients. Is that a lot, or is that a normal number?
Well, I think that it is a relative number, because we have different flavors of trauma, right? In and of itself, for a center to have almost 1,700 patients that are entered into the registry, that is a significant number of people. It kind of speaks to the importance of us as a trauma center being here and being available to the community. and also being a resource to some of our neighboring areas as well. Because otherwise, those folks with those traumatic injuries would have to go much further.
And sometimes in a traumatic related injury, time is the most important thing that you have on your side. Getting to care as quickly as possible could really make the difference and make a difference in the outcome.
Yes, ma'am. Yes, ma'am. And there is a phenomenon called the golden hour that we talk about in trauma. Basically, when you have whatever event that has happened to you, you have an hour to really see how much we can help, because that will set the trajectory for your care moving forward. And this, for people who are minimally injured, is not quite as important. But for people who are very severely injured, that hour is critical. That could be the difference between life and death in that time frame. So
if I have a broken leg, that first hour isn't nearly as critical in getting to care and getting it repaired as it is, you mentioned earlier, a car accident, and it truly is a life or death situation.
Yes, that's 100% true. And we see that on a regular basis. Folks who have had injuries that for whatever reason, they were unable to reach us in a timely manner. There are lots of different reasons why that. Those people can be quite ill and sick, and unfortunately, their chances for mortality or death go up tremendously if we have not had the opportunity to intervene on their behalf in that time frame. So getting patients to our facility for us to have definitive care as quickly as possible is one of the very best things we can do to improve their outcomes.
A lot of the statistics that I was looking at, your trauma related injuries were fall related. Some of them ground level falls, but not all of them ground level falls, which is kind of what I always associated trauma with until I started realizing, no, it comes in a whole lot of different forms.
And I think that it goes to what you were speaking about a little earlier about what is a trauma and what does that mean, and how is that different from just some kind of emergency type of event? To speak to that, there are falls, and that's an event, but it doesn't really become a trauma unless there is some injury that is the consequence of the fall. So for example, your great grandmother is at home, slips on the floor, she has a fall. Well, if she's lucky, she may just got a little boo-boo, and everything's okay. But oftentimes, that kind of fall, especially in our elderly population, which is a pretty significant component of our trauma population. Broken hips, broken bones, severe soft tissue injuries, they are consequences of that fall. And now that is a trauma. That is a traumatic event that now requires medical, and that might mean just an assessment and then a plan for rehabilitation, or it could mean an operation in order to try to maintain functionality, which ultimately will lead to improvement and recovery, as opposed to people who don't have the ability to do that or cannot have that part of the rehabilitation completed. Those people have bad outcomes or worse outcomes, become severely debilitated, and those people have a higher chance of death. And that's really just one of the realities of trauma. You have to be able to intervene. Now, in terms of what we would consider more of a garden variety kind of injury, is a lot of these slip and falls. But fall in and of itself is a catch-all term, but there are multiple different severities of those falls as well. There are people who fall downstairs, and that can be a significant amount of energy that causes multiple traumatic injuries. People who fall off of something. Just as an example, we very recently had a fellow in his 60s, pretty robust guy. He was standing on the top of his truck so that he could cut some branches off of a tree. So tree versus person, the tree almost always wins. And so that person ended up having the tree limb fall on him. He then fell off of the truck and he sustained multiple injuries to his chest. He had multiple rib fractures. He had contusions to his lung. And that gentleman had some significant consequences of that injury. These things can, at face value, look fairly straightforward, but some are very complicated and complex. And the thing that we see that has the most injury and often causes the most significant and often devastating injuries are car crashes, collision with any motor vehicle. I just put them all in one bucket. The energy that passes through your body is tremendous and can cause a whole host of traumatic injuries that can span anything from a traumatic brain injury and bleeding to fractures in which you have significant soft tissue injury, bones that are crushed, organs being pulverized. So, I mean, these are very severe injuries sometimes. It takes a lot of coordination with multiple members of the team in order to achieve the outcome.
And a lot of these scenarios that you're talking about are 100% preventable. Like that guy could have gotten a ladder. He could have called a professional. He could have probably listened to his wife when she said, don't do that. There were a number of things that could have been done differently that would have prevented that whole scenario. And the same with car accidents. I have Lieutenant Warren Gosnell from the Frederick County Sheriff's Office does a radio show with me every single month. And he's the traffic division commander and talks about safety over convenience. Don't get in such a hurry that you're not paying attention to where you're going. And the next thing you know, you're caught up in a car accident. Pay more attention to motorcycles when you see them on the roadway. Motorcycles should be more aware of cars when they're on the roadway. A lot of this is prevention as much as it is taking care after the fact.
Correct. And Jenny, she and her partners at the APC level, which is our advanced care practitioners, they have an opportunity often to speak in even more detail with patients and their families regarding circumstances of.
We do have the opportunity definitely to talk to the family members, whether it's parents of the children who've had the trauma or spouses or partners of the person who had the trauma. A lot of times they've already been told that they shouldn't have done that. So we try not to harp on that too much, but also sometimes it's the children who are taking care of their parents in their reverse role. So we get to talk to them because sometimes, you know, it's time to maybe talk about not driving anymore. Maybe it's time for us to use the moment that's been given to us to tell children about certainly always wearing your seatbelt, not driving distracted, always when you're riding a bike, wear your helmet. So we do get to just kind of slide in politely some prevention tools or safety tips of just things that this trauma wasn't so bad. You're okay. You're going to get to go home. It's an inconvenience and things like that, and you'll have to get over it. But let's make sure next time you think about these things before you get on your motorcycle. Maybe if you've had too much to drink that day or anything to drink that day, you shouldn't do that. Knowing the weather before you get on your motorcycle, knowing the weather before you get on your bike. We've talked several times about the increase in bike accidents we've seen since the pandemic, because that's a good socially distant activity. We've definitely seen an increase in that. So talking about just prevention of where to ride your bike, when to ride your bike, wear a helmet, you know, don't have your headphones in. It's nice to listen to music while you're exercising, but it may not be the right thing to do. So just things like that. And we've seen an increase in ATV accidents, especially younger teenagers using these ATVs to get around, have fun, that kind of thing. And as they've gotten more sophisticated, there's like side-by-sides now, there's things you wear seatbelts in and things like that. But you should still wear a helmet. You should still wear the seatbelt, use the safety equipment and things like that, because they certainly are dangerous. And we've seen that. So.
And that makes it a little even more complicated, because when you've got children involved and you've got parents who maybe aren't taking all the precautions they should, and then the child is the one that suffers a trauma, that comes with a whole nother set of issues and problems after the fact.
Right. We definitely see the lifespan with trauma patients, because you can get into it at any age, and it's interesting to see how things affect you differently. A 20-year-old who falls definitely has the same exact fall as an 80-year-old. They do not have the same injuries because of how physiologically you change through the aging process.
I had this list of summer trauma prevention tips, and I understood why motorcycles and bikes and swimming, even sun safety, why they were on there. But the one that kind of confuses me are snakes. Is that a traumatic event?
Since we are in a more rural area, we do see more snake bites, especially during the summer months. And copperheads and other venomous snakes are actually a big problem. Last year, we actually didn't see quite as many as we had the year before, but really it is something that we as the trauma service and the emergency department, who also see a lot of these, taken on as our responsibility, because we probably have the most expertise in it. So we tell for folks for prevention, like most traumatic injuries is the best way to approach. So things like keeping your lawn managed, no high grasses, stay out of those areas, remove brush and debris and piles away from your home. Snakes love those. So don't do that. Try to avoid that. Always you're wearing shoes outside, which is a big ask here in the Valley. So, we fight our battles where we can. Try to make sure that you have visualization. Watch your hands. Watch where they are. Don't put them where you can't see them, in holes and other places that are dark and cool where snakes would be going to cool off, especially during the hottest part of the day, especially, and then when you're hiking, wearing boots and things like that. And we had discussed the copperhead is one of the venomous snakes. The other big one in this area would be rattlesnakes, believe it or not. So having some awareness of that can help to prevent an injury.
My husband is in pest control, and he's been doing that for several years now. Until he took that job, I had no idea that we had rattlesnakes in Virginia. And the first week or two he was on the job, he sends me this video of one that he had to take off of somebody's back deck and put in a bucket. And I'm like, dude, this is not the video you send your wife in the middle of the day, your second week on the job. This is just not a smart thing to do. But yeah, we have a lot of these venomous snakes that you need. Again, it goes back to a time factor. The quicker you can get help, the better your outcome is for recovery.
Exactly, which is always advocating a quick assessment, an early assessment. We work in close collaboration with the poison control when it comes to the management of these snake bites. They've been very, very helpful in helping to guide care. But we do have established protocols or guidelines care as well, so that people can receive a more standardized approach to the management.
Well, Dr. Goode, Autumn, Jennifer, thank you so much for spending some time and explaining the trauma center to me today. I do appreciate it.
We're happy to be here. Thank you for inviting us.
Yes, thank you.
I will be back tomorrow. It is Extension Office Friday, so I am chatting with Mark Sutphin, I assume, about spotted lanternfly, because it's still a thing and you still need to know about it. So meet me back here for that conversation just a few minutes after noon.